Hello, my name is LaTisha Pike, and this is my DNP presentation on how to increase tardive dyskinesia screenings. Many thanks to Dr. Kern, who was my chair, and she helped to guide me through this process. And I would also like to thank Angela Stokes, who is my community member, and she is also my nursing supervisor at the agency. So, the purpose of the project was to introduce an algorithm that would help nurses to determine exactly who is eligible to be screened for tardive dyskinesia. I focused on adults ages 18 through 65 who were prescribed antipsychotics during a certain period of time. The expectation was to have a minimum of a 10% increase in the screenings post implementation. When analyzing the data, it was found that there was a 23% screening on average before the algorithm was introduced. And so we would expect the post implementation proportion to be at 33% at least. So, just to give a little bit of background information on tardive dyskinesia, this movement disorder is a very unpleasant side effect of antipsychotic use, especially with prolonged exposure. If you look to the left, you will see various examples of how tardive dyskinesia is experienced in different regions of the body, whether it's in the mouth, in the torso, the eyes, or it could be experienced in the upper and lower extremities. This can be very debilitating for a person who is experiencing this. It could cause them to have decreased completion of their everyday task of daily living, and it could also cause more mental health symptoms as they may be too embarrassed to go out and socialize. As of now, the prevalence of TD is up to 25%. So, as stated before, antipsychotics are very important in eliminating a lot of the psychotic features, and unfortunately, there are times where the causative agent cannot be removed. So, it is important to monitor and detect tardive dyskinesia or TD. One of the main uses is the abnormal involuntary movement scale, or known as the AIMS test. To the left, you will see a form that can be completed very easily. It is a 14-item checklist that will be completed by a clinician. The patient needs to be sitting and with their feet flat on the floor. Definitely does not take a very long period of time to complete this, and many of the items can be rated just by walking and talking with the patient. So, for the literature review, there were various keywords that were used in order to find evidence based literature to support this project. Some of the keywords were monitoring, screening, flowcharts, algorithm, neuroleptics, antipsychotics, and mental health clinics. There were thousands of articles that came up from various databases, and after eliminating those that were not appropriate, it came down to 12 pertinent articles that helped to support this implementation project. And there were three themes that came from the literature. The first one was evidence-based screening tool that we just saw on the previous screen. It was created back in the 70s just for TD, and it is considered the gold standard in monitoring and detecting tardive dyskinesia. The second theme was algorithm usage. Many of these successful implementations did use algorithms in order to increase the TD screenings in various settings. And third was the positive results and outcomes. Again, using an algorithm and using evidence based tools help to successfully increase TD screenings. Some of the agencies saw up to 50 to 100% increase in TD screenings just from using an algorithm and using the gold standard to monitor tardive dyskinesia. So there were various frameworks that could be chosen in order to model and structure this project. The most appropriate one was the Theoretical Domain Framework, or TDF. It was created in 2005 in order to enhance implementation science by consolidating several other theories and psychological concepts. It has actually become most favorable among researchers because it is very useful in helping to increase the buy in from healthcare providers when implementing evidence based research. So there are various domains within this framework, 14 to be exact, and all of them were used in this project in order to facilitate the success of the increase of tardive dyskinesia. And a lot of them overlapped in several areas. The next step was to establish the type of research study that would be most appropriate for this practice change. I chose a quantitative exploratory design that would use the agency's electronic health records in order to complete a retrospective chart review. The agency in question has several clinics throughout the state. I chose the two that were in close proximity to me. Again, the population focused on adult patients who were treated with antipsychotics and between the ages of 18 and 65. Again, because this was a chart review, none of the patients were engaged, and therefore there was no need for any additional informed consents. In addition to that, there was no identifying information that was retrieved or extracted from the chart reviews as well. So to the left, you will see the algorithm that was created for the nursing staff. Both of the nurses were supplied with this algorithm electronically and were able to print it off if necessary. It gives them directions on how to determine who needs to be screened and how to record and report the information. The timeline for this implementation was from February of 2023 through April of 2023, which was the pre-implementation period, and from May 2023 to July 2023 was, of course, the post-implementation time period after the algorithm was disseminated to the LPNs and put into practice. To collect the information and to complete the retrospective chart review, an Excel spreadsheet was used as the data collection instrument. The information technology team from the agency was gracious enough to complete the report starting from February 2023 to July of 2023 from both sites where antipsychotics were prescribed for adults between the ages of 18 through 65. The budget for this project was $715.44, and that includes electricity, any resources that were needed, and lunches for the nurses. Most of the items in the budget were normal operating expenses, and so this implementation project was a very low cost way to increase tardive dyskinesia screenings. For the analysis, again, a gold standard was used to analyze the data. The SPSS, or the statistical package for the social sciences, was used in order to analyze the pre and post implementation proportion samples. Again, the information was collected from the electronic health records, and an upper Z-tail test was used to actually compare the two different implementation samples, because it was inferred that an increase would be seen between the pre and post implementation periods. Therefore, an upper tail Z test was used, which was appropriate for this particular analysis program. So the critical Z statistic was 1.6199, and the p-value was 0.05. And in order for this project to be statistically significant, the z-score should have been above 1.6199, and the p-value should have been lower than 0.05. So here are the results of the implementation of the algorithm for TD screenings. As you can see, in May of 2023, when the algorithm was introduced, there was a significant increase in TD screenings in the agencies. But unfortunately, you will see that in the subsequent months of June and July, the TD screenings returned to baseline. So, unfortunately, overall, there was no statistical significance of introducing an algorithm to increase tardive dyskinesia screenings. Although the desired results were not achieved, there were several positive aspects of the project. So some of the strengths included the use of several gold standards that are used in research and in practice, such as the Ames test and the SPSS. The sample size was very large. Almost 8,000 electronic health records were actually used in order to analyze the success of the algorithm. The data was valid because it was extracted straight from the electronic health records, and because there was no identifying information included, then the patient information was protected. And even before this project started, there were monthly reminders from the medical director to always complete Ames testing if it was appropriate for the client. Because, again, we know that we can a lot of times not remove the causative agent, but we could definitely do our part to be sure that we detect, monitor, and treat tardive dyskinesia. In addition to that, the EHRs were updated during the implementation with an updated Ames form, and there were links that are now provided for the medical providers and nurses to get more information on TD and how to complete the Ames test. On the other hand, there were also some areas of improvement. As stated before, excluding patient information can help to minimize exposure and protect the patient, but including patient information can give some insight into the population by studying the demographics as well as the prescribing patterns. Also, because I am familiar with this agency, I am aware that there may be duplicates if medications had to be resent if they did not reach the pharmacy, as well as having patients seen multiple times throughout the pre and post implementation time frame. And so performing an AIMS every single time may not be necessary. Although I am in close proximity to both clinics, working remotely has, of course, limited the interactions, communication, and engagement with the nursing staff, which could help to create and keep the momentum for the use of the algorithm. Some of the barriers that existed. First, COVID, which has been an ongoing barrier since the beginning of the pandemic, has been difficult for all agencies and has caused telehealth to skyrocket, especially completing those that are mostly audio only. And this, of course, hinders the accuracy of completing an AIMS test if the patient and provider are not face to face. Lastly, unfortunately, with both of the LPNs at each clinic, there was a medical emergencies, and they both had to take a leave of absence during the post implementation time period. And so their absence definitely coincides with the decrease of TD screenings performed in the month of June and July. So there are some positive implications for the nursing field. Of course, we have always been the most trusted professionals in society, and we want to continue that tradition and continue to gain the trust. And so we are always aiming to improve the health outcomes for the patients. And in this particular instance, we are looking to decrease and minimize the side effects of antipsychotic use and decrease the movement disorders as much as possible. Trust is also important for nurse practitioners. We are more present than we've ever been, especially in the mental health field. We are closing the gap in treating patients as the number of psychiatrists and medical doctors are starting to decrease. And in addition, improved patient satisfaction and improved health outcomes can also lead to loyal customers and increased revenue for the agency. There are several things to consider for future research. Again, including patient demographics can provide more information on those who are prescribed antipsychotics and those who experience tardive dyskinesia. Although using multiple sites for this project resulted in an adequate sample size, data could be more manageable with the use of only one clinic for research. Additionally, bringing TD awareness to other support staff in the clinic along with the nurses can be helpful in increasing screenings and, of course, to mitigate the effects of the unintended occurrences that may happen. Here you will see all of my references. Thank you so much for listening to my project. If you have any questions about this practice change, please don't hesitate to contact me. Thank you again.